So again, I would like to welcome you to our webinar today. Today we are going to be talking about the CMS 855A changes, the changes that have been recently made to the new 914 version, and that includes the skilled nursing facility attachment. If you have not already downloaded materials for today's session, which is the presentation that I'll be using today, you can go ahead and download that. Information has been placed in the chat to access our training center, where you will just need to look for today's event, and you will see a link to the presentation, and you can have that. It's not required for this session, but if you would like to have that as you go through today, you do have that available. As I mentioned, we are recording this session today. That will be made available to you as soon as possible after this session, barring any issues with the recording of the session. And then that will be available on our WPSGHA website for 60 to 90 days without having to access our YouTube channel. And that's just going to allow you to view it again if there's something you want to see again, if you missed something, or you can share that with somebody that maybe wasn't able to attend today that you think might find this information useful. Beyond those 90 days, this recording, this encore, will be available on our YouTube channel for you. Questions today are going to be handled through the chat function. As I've mentioned, Ellen is helping me monitor those chat questions, and so she will be making sure that she gets those to me. I will be checking in with her. If for some reason we have more questions than time allows, I will be sending up a follow-up document to all attendees today so that you have all of those questions and those answers. And then finally, our ultimate goal is to provide you with an excellent customer experience, and we need your help to do that. We need to know what you think, what you liked about our sessions, what we could do better. So at the end of the session, you will be given the opportunity to take a quick survey to tell us what you thought. What did you like? What didn't you like? What could we do better? But also, this is your opportunity. If you think of subjects that you'd like to see in future education, you can share those with us as well. Last is our disclaimer. So the material that I am presenting today is accurate as of today. As you all are aware, Medicare does change often, and we encourage you to continue to monitor official CMS communications, including the CMS website and the WPSGHA website, for the most up-to-date CMS rules and regulations. Also, I will be answering questions based on current CMS regulations and the information that was presented in the chat. CMS also prohibits any photographing, screenshotting, or recording of this education for profit-making purposes. However, and as I stated, we are recording this, so you will have that available to you. All right, so that brings me to our agenda for today. So as I said, today's focus is going to be the CMS 855A, and it's the recently released 924 version. In the end of September, CMS did release an updated version of the CMS 855A. That CMS 855A revision includes some cosmetic and technical changes for existing sections, but also the creation of Attachment 1, which is the skilled nursing facility disclosure. The attachment is going to collect information regarding ownership, managerial control, and other additional disclosable parties as they relate to SNFs. So that's going to be the biggest change, but we are going to talk through the other changes as well. So during this webinar, we are going to go through the CMS 855A updates to existing sections. We're also going to talk about how to complete Attachment 1, that skilled nursing facility disclosures, including who should be disclosed on that attachment. So we're going to be talking about those additional disclosable parties today. We're also going to talk about the implementation timeline for submitting an acceptance of the new CMS 855A. And I will touch base, though will not be our main focus, on revalidation efforts specific to SNFs. So to start with, as you all know, there are quite a few acronyms that Medicare likes to use. Today I have included a short list of acronyms that I will be using throughout the session today, just so that you have them for your convenience. So I'm going to start with the reason for the change. So CMS reviewed the 920 or the CMS 855A, and in the 924 version, they identified some technical and some cosmetic changes that needed to be made, and that includes some additional questions where needed for specific provider types. And again, there is the new attachment 1 for SNF disclosures. Now, the SNF disclosure attachment is part of the Social Security Act, and it is in section 1124C. It is information that has been required, but CMS has not incorporated it into the CMS 855A until now. So we are going to go through that today and talk through that and hopefully get all your questions answered on that today. So as I said, there's the new attachment. You're going to hear a lot about that, but that's a big change, particularly for SNFs. So Section 5 and Section 6 have been traditionally used to report ownership and managing control information for all providers. Um, this change in particular is going to only impact SNFs, but they are no longer going to be utilizing Section 5 or Section 6 to report their organizational or individual managing ownership and managing control information. All other providers, so everyone excluding SNFs, so hospitals, critical access hospitals, FQHCs, these facilities are still going to report their ownership in Section 5 and 6. Nothing has changed there. The sections still exist. However, for SNFs, they will no longer utilize Section 5 or Section 6. They will report their information on the new Attachment 1 for the SNF disclosures. And we'll again talk about that. And as I mentioned, we do have some verbiage changes and some new questions. I want to go over the timeline before we jump into those sections. So on October 1st, MACs began accepting the 924 version of the CMS 855A. And we are currently accepting the 924 and the 923 version of the CMS 855A. And we'll continue to do that through November 30th. The exception to this is going to be for those skilled nursing facilities. SNFs have been required to submit the 924 version of the CMS 855A since October 1st. If we receive, say, for an initial SNF, a 923 version, that is going to be returned and we will be requesting the 924 version. And again, this has everything to do with that attachment. They are wanting that ownership, that managerial control information, and those additional disclosable parties reported in the new attachment. You'll hear me say this a few times, but Section 5 and 6 no longer apply to skilled nursing facilities. However, everyone else outside of SNF are going to be able to submit both the 924 and the 923. I do recommend that you do start submitting the 924 version if you have an enrollment coming up. The 923 version is currently on CMS's website, and the provider enrollment chain and ownership system, also known as PACOS, has been updated with the information contained in the 924 version. We'll talk about how that's going to look, though. It's going to look just a little bit different in PACOS, and we'll talk through that in this session. The other important date to keep in mind is December 1st. So on December 1st, MACs will no longer accept the 923 version of the CMS 855A from any providers. On December 1st, all providers must submit the CMS 855A application, that is the 924 version. So those are some dates to keep track of. So let's take a closer look at the changes. I am going to begin with the cosmetic and technical updates to the existing sections. I'm also going to be using the paper form as visuals for these. The changes have been made in PACOS, however, they were just recently made, so I didn't want to show you screenshots that were not the updated information, but that information is there. So I'll start with section 4, practice location information. The big change here is that in section 4A, where you report the practice location information, there is an additional question and it's specific to hospice. So it is asking the question, it's asking if the location being reported is one in which the hospice is going to be treating patients. It's a simple checkbox. It's a yes or no question. And then it's not even a yes or no question. It's just a checkbox, just letting us know that this is where patients are being treated for hospice. And again, it is for hospice only. This doesn't impact SNFs. This doesn't impact critical access hospitals, FQHCs, any of those other Part A providers. And it is a question that does need to be answered by practice location that's being listed. So, and again, only checked if it applies. The next section that you will notice a change is going to be the section 4 electronic storage, and this has to do with Medicare beneficiary medical record storage addresses. They've made some adjustments to the electronic storage section. So previously they were asking, are you storing electronically? And they would ask for the name of the facility. They have added the legal business name, the tax identification number, and a street address. Couple of things here to keep in mind: that legal business name has to match what is on file for that entity with the federal IRS. So not a doing business name, it does have to match what is on file as the legal business name with the federal IRS. Federal IRS. The street address, that does have to be a street address. We cannot accept a PO box, so you just want to make sure that you're including that information. If the PO box is on there in addition to the street address, that is something we can disregard, but we cannot take the section if it only has a PO box. The last section that they updated before we get to the SNF disclosure attachment is section 6 for ownership and managing control for individuals. Here we have added a section to be completed by hospice providers again, only when completing the W-2 or contracted managing employee roles. They haven't made a change to the roles available, but they've added a question. So the question asks those that are indicating that they have a managing employee role for a hospice, they're being asked to check the box indicating if they are the hospice medical director or hospice administrator. They may not be, but if they are, we are asking the providers to make that designation. Okay. With that, before I go into the disclosure, because that's definitely its own topic, I'm going to check in with Ellen. Do we have any questions on what we've covered thus far?
Leanne, we do have a couple of questions. The first question comes from Dee Dee, and she says, for a SNF change of ownership information or a CHOW, how can we already know those vendors who could potentially be the ADPs for the initial enrollment?
So that is a question, it is something you are going to have to, how do I want to say this? With the CHOW situation, when we get into the ADPs, we'll explain who those are. For SNF CHOWs, we're not looking for the seller to report those information because typically that seller is going to be deactivated. But for the buyer of that CHOW, for the new entity, we're going to need that information reported for the buyer.
Okay, thank you. We do have another question from Melissa, and it says, does the electronic storage include active electronic health records or only for other electronic storage of records such as historical?
I'm going to assume you're meaning for historical records. We should be having all of the electronic record storage included on your application. If there's some that you had prior to this being something that needs to be reported, you can submit that as a change. It's also something we're going to ask for on revalidation, and you're going to want to make sure that you include all of those vendors, all of that information that's actively being used, um, even for historical records on that application, so that we have that for those electronic records.
Okay, and we have an additional question. Is it possible to complete a buyer's chow online in Pecos?
It is, but is generally going to look more like an initial, but it is possible to complete that in Pecos.
Okay, and one additional question. So the new operator will report only those known pre-chow and then update as they bring on vendors who are ADPs.
Right, you'll report those that are known that are in place now. As you add additional, you will add those ADPs. Now, as we get into SNF situations, I think some of this is going to become a little bit more clear. We are going to go through what has to happen with revalidations, because providers are going to be asked to do an off-cycle revalidation, and that will be leveraged to obtain all information that is currently in place.
Okay, that's all the questions we have. Oh, one more.
Yeah.
We need to ask our EHR vendor for their tax identification number and their legal business name. And the question is, do we need to ask? And then the second part of that question is, what street address would a vendor like Epic use?
That's a really good question, and the answer is yes, you will need to ask it. It's really not any different than, say, a billing agency. It's a different purpose for the entity, but it's the same concept of these are individuals that have access to those medical records, and so CMS is wanting to gather more information about them, and so we are going to need that information. A street address for a vendor like Epic, that should be something they should be able to provide what address they want to use. If it happens to be their home office, if that's the address they want used, that would be acceptable. We just need the street address. We understand with things being electronic, but we're looking for the vendor. So you need to reach out to them.
Okay, and that's all the questions we have.
Okay. So then we're moving on to our SNF disclosures. And this is that attachment one, SNF disclosures, that is that brand new attachment, again, only applies to SNFs. So this attachment for SNFs is intended to collect all information that they have always reported previously in Section 5 and 6. So what SNFs have always reported, just like any other provider in Section 5-6, owners, managing control information, none of that's changed. We're capturing it in a different spot and expanded the information that they're looking for. So I do want to be very clear, though, as I go through this. If CMS 855A 924 version comes in, and there is information in Section 5-6, and that same information is not also in the attachment, we're going to be developing for the information. That is because MACs have been instructed by CMS to disregard information in sections 5 and 6 for SNFs. Section 5 and 6 for ownership and managing control no longer applies to SNFs, and we cannot take it from there and move it into the attachment, so to speak. Partially because the questions have changed a little bit as well. The information that was in 5-6 is all still there, but it's been expanded. So just bear that in mind if you start seeing developments on that. So as I said, it's been expanded, which means in addition, those SNFs are going to be reporting additional disclosable parties. And those disclosable parties are part of the Social Security Act, and they are part of Section 1124C. And I didn't point this out, but I did include a link in a previous slide, so if you'd like to look at that, you do have access to that. As we go through this, I have included some Code of Federal Regulation or CFR references that do also include definitions of those disclosable parties so that you'll have those. So with the new disclosure attachment. Essentially, it breaks down into 5 main categories of data that must be reported. So all LLC or limited liability companies, all corporations, all LLC owners need to be reported. So if the SNF is an LLC, all of their owners need to be reported regardless of percentage. And that's going to be a change because there is a 5% threshold in section 5 and 6. That 5% threshold for a SNF that is an LLC has been removed. And as you go through the questions in that attachment, it's going to ask about the SNF's organizational structure. And we'll talk about that a little bit more here. The next category is if the SNF is a trust. If the SNF is a trust, all trustees are going to need to be reported in the attachment. If there's a governing body, so all governing body members, regardless of the organizational structure of the SNF, must be reported. Now, previously, this was limited to corporations who had to report their own officers and directors. But this is one of the areas that's been expanded to include partnerships, LLCs, limited partnerships as well. And then the biggest change is going to be reporting ADPs. Now this is going to include, and this is where you get into uh, the 5th section, it's going to include the organizational structure of each ADP. So not only are they going to be reporting those additional disclosable parties, but we're going to be asking questions and need reporting on the organizational structure of that ADP and relationships to SNF. Okay. Now, the section is broken down similarly to section 5 and 6 in that there is a section for organizations to report their information, and there is a section that is asking about individuals. So that's going to have a look and feel. Again, a lot of the same information from 5 and 6 is being added or required or asked for, but it is expanded. So keep that in mind. And this attachment, for those on the call that are not skilled nursing facilities, this attachment is specific to those skilled nursing facilities. Um, it's not an either or situation, as I mentioned, and you'll hear me say this a couple of times. For SNFs, we have to have the attachment. It's not the attachment or 5 and 6. 5 and 6 will be disregarded for SNFs. So for the SNF disclosure structure, as I said, there's going to be an organizational side and an individual side. The organizational side is a little bit longer. And I just want to run through what that structure looks like. So we have for organizations subsection A, which is identifying information. This is all the same information that is collected in section 5 today, or a lot of it. It's the name, it's the tax ID, it's the address. Okay, so it's that contact information for that organization. Nothing's changed there. Subsection B for an organization is organization type. Again, this is similar. One thing that is new is subsection C. Subsection C is replacing what used to be section 7. So if you've looked at the form and noticed section 7 is missing, it's not missing, it was reorganized and added to the attachment. The idea here was to make this attachment kind of a one-stop shop for all of this information. We didn't want the providers to get to a point in the attachment and realize, oh, now I have to go back to section 7 to complete this information. It also helps with the structure in PAYGOs. Now those 3 sections, A, B, and C, nothing's really changed there. So those are not subsections we're going to focus on. We're really going to focus on this next one, which is subsection D. This is where you get into a series of yes or no questions, and we'll cover high level what those questions are. They are going to be responded to differently based on the structure of the SNF, the structure of the ADP, but we'll talk through some of that. But that's the relationship to the SNF. It's going to ask things about what kind of services the ADP is providing. This is really all about those ADPs. And then subsection E is going to be the adverse legal action or the ALA information. There's no change here. That information is the same as what um, every provider is used to giving on a CMS 855 application. Now for individuals, the section is a lot smaller, but we have some of the same information. Subsection A is going to be that identifying information, exactly what's asked for in 6. Name, social security, national provider identifier, NPI if they have it, PTAN if they have it. We're asking for that same information. B is going to be that ADP relationship, those yes/no questions that I just talked about. And they're really not going to vary that much between an organization and an individual. They're going to be worded a little bit differently, but we're really looking for that same information. They really mirror each other. It's just who we're reporting it for. And then subsection C, that's going to again be that adverse legal action for the individual being reported. Now, one thing I want to point out here as well, with the attachment, you can report one entity. You could do one organization, you could do one individual. If you're doing the paper form, you would need to copy and complete that for every party that you are reporting. If you've got multiple organizations, you're going to have to complete multiple attachments. Multiple individuals, you're going to have to complete multiple attachments. For this reason, and I will always lobby for the use of PACOS, but I recommend completing this information in PACOS. It's simpler, you can add another party, it's a little bit quicker. The one thing that I want to call out is in PACOS, there isn't an attachment 1 SNF disclosure section. In PACOS, because the sections, the topics are not numbered, they're just alpha titles. It is still going to be reported in the organization ownership and managing control and the individual ownership and managing control. So it's not going to show up as an attachment. However, the section's going to look different. For anybody who's not a SNF, it's going to look like section 5 and 6. For SNFs, when you're revalidating or submitting a new, based on that skilled nursing facility provider type selected during the questionnaire process of setting up your application. On SNF, the questions are going to change and they're going to show you the attachment questions. So CMS decided to go that route versus completing another attachment or differently titled section. So just keep that in mind. So let's talk about what is an ADP. So because an ADP or additionally disclosed party is that expanded ownership and managing control for SNFs, I really do want to spend some time talking about what that is. As I mentioned, ADPs are defined in the CFR 42 CFR 424.502, and I have included a link here for you so that you have that information. If you want to look at that CFR language or reference that later on, if you have a question about does somebody meet the qualifications as an ADP. One thing that I saw in some of the pre-submitted questions, it's not as simple as a title. It's about what they do and what they provide, what services they provide for that SNF. Okay, so we're not looking specifically necessarily for titles when it comes to ADP. So what we're looking for is an entity or an individual. So this can be for, again, it's not different for entities or individual. It's for either one. But we're looking for an entity or individual that is providing policies or procedures for any of the SNF's operations. So that's a question you'll have to ask yourself when you're determining who is an ADP. Are they creating policies and procedures for any of the SNF's operations? Do they exercise any operational, financial, or managerial control over any part of the SNF? And this is really pretty broad. That's intentional. CMS was looking to broaden the scope based on the final rule they drafted. It would have been in 2023, and they've not acted on it till now, and the comments that they received from the provider community. So they're wanting to expand what is reported. We're also looking for any entities or individuals that are providing any type of financial or cash management services for the SNF. They will need to be reported. If they are leasing or subleasing property to the SNF, anyone that owns at least 5% of the total value of the SNF's real property. So we're getting into some of those mortgage interests here. If they're providing management services, if they're providing administrative services for the SNF. It could also be an individual or entity that's providing any clinical counseling, as I mentioned, financial services, I'm sorry I have that twice, or accounting services. So this is not just reporting organizations with managing control. We're going beyond just managing control here, and we're going beyond ownership. So the new attachment, in addition to asking who the ADPs are, it's going to be asking about the organizational structure of that ADP. So here we're looking not at the SNF business structure, though we do that earlier in the section. We do ask questions about, not so much about the SNF organizational structure, but statements and questions surrounding if the SNF is a corporation, if the SNF is a trust. It's asking those questions, and what you'll notice is the questions are staggered in a yes/no format, and that is to make sure that we are getting confirmation of the relationships, the organizational structures, but also to help the providers work their way through the questions. Some questions may not need to be answered based on how other questions are answered. So it's going to be really important to read through those questions and identifying if they apply to your situation. So for the organizational structure, as I said, we're digging a little bit deeper here. And this is a separate section in the attachment, but we're digging deeper into the owners and directors of the ADPs themselves. Okay, so we are reporting the ADPs. Now we want to know a little bit about their organizational structure. So for corporations, the ADPs have to include all officers, directors, and 5% shareholders of that ADP. They have to be reported. The LLCs, we need all owners regardless of percentage. Remember I said that 5% for LLCs is no longer there. So 3% needs to be reported. It's an LLC, we need everybody. For general partnerships, we're going to need all of the partners to be reported. Limited partnerships, they're a little bit different. We are going to need all general partners, regardless of percentage. And if there are limited partners with at least 10% interest of the limited partnership, we are going to need those individuals or entities reported as well. And then lastly, with organizational structure, trusts, we will need all trustees reported just like we would for the SNF. So the bottom line here with all of this, with ADPs, is really that ADP, if we need to have all of the managerial control, all of the ownership, and all of the ADPs reported. And they have to report all of 5% or greater ownership, again, except for LLCs, the percentage there doesn't apply. Any managerial control, partnerships, we need to understand leases and subleases for real property of that SNF, and then anyone who owns at least 5% of the real property. And again, it includes persons and organizations that are furnishing services on behalf of the SNF. These are going to qualify as ADPs and need to be reported. So there is one that third level is really what's a huge difference here, is that affiliation, because now we're asking not just of the direct and indirect owners, but we're asking for ADPs and owners, direct, indirect owners, managing control of the ADPs themselves. So it's really a third level we're going into. And with all of this, we are going to need those organizational diagrams that are going to show that information. So we are going to dive into the sections themselves. And here you are seeing a paper and a PACOS version of the section. They do ask the same questions, but again, remember I said that the attachment 1 in PACOS is not going to be titled as attachment 1 for a topic. It is still going to be the organizational ownership and managing control or the individual ownership or management control, and the questions change based on the provider type. For everybody else, it'll look as it always has. For SNFs, it's going to have the questions for the attachment. So there are subsections, and we're going to start with the organization section. Like I said, there are subsections. Subsection D is really what's changed. The other sections are all existing that have either been consolidated or asking for the same information. And again, I will say section 5 and 6 say on a paper application and the attachment are not interchangeable. So what I'm going to focus on, as I said, is going to be that subsection D. That's where the list of questions are the yes or no questions. Um, it is in a yes or no question format, again, to make this simpler. So I'm not going to go through each and every section or every question individually. I'm going to go through the categories of questions. And that is because one, there are quite a few, but two, it's also going to be different based on it's going to be individualized based on your organizational structure, your business structure. So questions 1 through 8, that is largely currently required data in the Social Security Act, Section 1124C. So it's the role information. It's asking that. It is going to be asking a little bit more directly about if the SNF is an LLC or if the SNF is a corporation or is a trust. It's going to phrase the questions a little bit differently, but it's really looking for the role. Make sure you're reading through those questions because if your SNF isn't a corporation, then you're going to answer that no, and you may be able to skip some of the questions. So you really have to read through those carefully to make sure that you're answering the questions. We are looking for all of the yes, no questions to be answered. It's some of the sub questions that may not be needed based on how that yes, no question is answered. Questions 9 through 13, this is all about the ADP. So they're asking if they are an ADP, and they're asking them to report what types of services that they furnish with the SNF. So this is that relationship to the SNF that we just talked about. That's what 9 through 13 is asking for. Okay. And there was nope, sorry. I apologize. The next slide, we have a slight numbering change, just an adjustment. I'll point that out. Questions 14 through 18 is the ownership and management of the ADP. So this is that third level. An ADP has been reported. Now we want to know about that ADP's business structure, whether it's an organization or an individual. Again, yes or no questions. And based on how you answer those, you may have to provide some additional information. Question 19. Now, question 19 is intended to establish the connection if they have any relationship with any other ADP that's been reported. Okay, so CMS understands that there could be links between the parties being reported, and CMS wants to understand that. This could be the SNF or another ADP. More likely than not, it's going to be another ADP because you've already addressed relationship to the SNF. But as I stated, walk through those yes or no questions, read those questions carefully, and consider how they apply to your organization. Who in your organization or what other organizations related to you do they apply to? So on individuals, this is where you might notice a slight numbering difference from this presentation that you downloaded. The slide here is showing that update. So again, questions 1 through 8, and we're talking about individuals here. This is the currently required information. The name, the social, MPI, P10 if there is one. Question 9 is for governing body members. So this may not apply to everybody. It's a yes or no question. It'll ask if the ADP is other than, and it'll list some different structures, identifying them as a governing body, and then it will instruct for further questions if there is a governing body that is not, say, a corporation. Questions 10 through 16, again, we're really digging into that ADP information and wanting to know what types of services are provided to the SNF. Questions 17 through 22, again, mirrors that organization. We're asking about the ownership and management of the ADPs. And then 23 is again that relationship, understanding links between the ADP that's being reported and other ADPs. So with this, some big changes for SNFs, and because of that, I mentioned earlier, CMS has decided to conduct an off-cycle revalidation. So the off-cycle revalidation is being performed for all active SNFs, and it is a large number. They have posted on their website the intent to do this. It began in October. WPS sent out their first round of revalidation requests to providers on October 7th. Now, because of the anticipated volume, there's a few things we're doing here. So OMACs are staggering their revalidation requests. All revalidation requests were not sent out in October. They are breaking them up into thirds, and they will send a third of them in October, which we've done. Another third will be sent in November, and the last round will be sent in December. The dates on the revalidation lookup tool are not being adjusted. This is an off-cycle revalidation, and it does not impact the 5-year cycle. This is an off-cycle revalidation because of the change to the format and CMS direction. So that's why you're not going to see those dates there. But I can assure you that all active SNF enrollments are going to be revalidated in the coming months. With that, we are offering some education, and I'll go through the rest of this in a minute, but I want to make you aware that we are offering some education in the next few months. We are doing webinars specific to SNF revalidations. Now, there's a lot of similarities between that and a regular revalidation that's during the normal cycle, but we wanted to make sure that we are reaching the providers impacted, so we are also sending out invitations to the email addresses that are on file for those provider groups so they can be aware of it. But anyone's welcome to those sessions, and they will be available on our live events page, and Ellen has put a link to that in the chat. So that you can check out, see what dates work for you, register if you're interested. So you have that. So with the off-cycle revalidation, you must complete it on a CMS 855A 924 version. Okay, doesn't matter if it's before December. Right now, all SNFs need to be completing that 924 version of the form. It will be all active SNFs, as I said. If there are SNFs that are enrolled in multiple states, they will receive a revalidation request for each one, not as a whole, because it is by jurisdictional state, by enrollment record. As I said, we will be sending out that notification. That notification goes out to the correspondence address, and then it could possibly go out, you could receive two others. It'll also go out to the practice location and the special payment. If they're the same, you'll only get one more letter, but if all three are different, you could potentially see 3 letters. And that's just to make sure that we're reaching the providers. It is based on information that's currently on the enrollment record. So as long as that's up to date, you will get that letter. Now, because this is an off-cycle revalidation, it's not the normal 60-day response time. CMS also recognizes the magnitude of the information that they're requesting. We know this is going to take time. So they are allowing 90 days to respond to these revalidations. So keep that in mind. There's a little bit. However, and we'll develop for missing information. We understand that that's probably going to happen. This is a new form. People are going to have questions. However, make sure you're responding to those requests and those revalidations, those development requests and those revalidation letters timely, because the end result is the same for these revalidations as it is any other revalidation. There is the possibility of payment interruption. Now, bear in mind, if you send in a revalidation, say it's day 85, we have your revalidation. So on day 90, we're still processing your application. Your record would still be maintained and functioning. I don't recommend waiting that long, but we also again understand that it may take that long to get this information. So don't panic if you get it in and it's day 85. If that application is in-house and if you send it through Pecos, we'll see it on day 86. Um, we have that, you've responded, okay, and we can develop from there. So just keep that in mind. Here I have provided some resources. Some of these are existing resources that you've probably used in for provider enrollment tasks before. So links to the updated application. You're also going to see links to the CFR from CMS. We are also in the process of publishing a resource, it should be there shortly, that walks through the sections and the information that's required in each section. Unfortunately, was not able to share that with you today, but that is coming soon, so be aware of that. That will be helpful for you. So that brings me to questions. And before I check in with Ellen, I do have a couple of pre-submitted questions that I'd like to go through. The first one had to do with the security of the information that's being requested. So there are some entities that are being asked to report sensitive information, tax IDs, social security numbers, names. The question was about the security of that information. Those of you that are adding information for people who are less familiar with enrollment or haven't been asked to do so before, this information is being stored inside the Pecos system, and that is a very secure system. Nobody gains access to that system unless CMS deems they have a need because they're working with provider enrollment. The other piece of that is this is not going to be published or anywhere publicly accessible. So that information is absolutely secure. The next question that I wanted to run through was if an ADP is unwilling to provide the information requested or any part of the information requested, the ownership information, the organizational chart, should they be disclosed with the information they did provide or that we know? So you can do that. However, I would encourage you to try and get the rest of the information because what's going to happen if the section or any of those pieces are incomplete, we are going to develop for that information. So that's just something to keep in mind. Should there be a reason they're not disclosing it, you can certainly include some type of letter or notification as to why, and we can work with CMS. But at this time, our directive is to develop for that information. We do need to have it. All right, with that, I'm going to check in with Ellen. Ellen, do we have any questions in the chat?
Sure. The first question says, in organization subsection D of attachment 1, aren't the SNFs required to disclose not only the ADP relationship to the SNF, but also the ADP relationship to all other ADPs of the SNF?
Yes, they are. That is that third level of relationship that we're asking to be disclosed. That is correct.
Okay. Wait a minute, I just lost my question. There we go. Okay. So that's the same one. Okay. The next question we have is, what about reporting mortgage holders and banks? Are they required to submit the ownership of those mortgage holders? The person is kind of questioning whether or not they can get more than the tax ID.
So if there is ownership, 5% or more ownership in that uh, real property, we are needing that information. And again, understanding that's going to be a challenge, but that is what we're asking for. And that is expanded information from what's been asked for in the past.
Okay, thank you. The next question says, is there a difference between a Section A entity and an ADP?
I am sorry, Ellen, you cut out there. Can you repeat that for me, please?
Sure, sorry. Is there a difference between a Section A entity and an ADP?
So, really, no. Well, there is. Section A is going to be who's being reported. So Section A is going to be for owners and managers, as you always have in Section 5 and 6. And then ADPs will do a Section A as well. So you're going to likely be doing multiple sections. If you have owners, managers, and ADPs, each ADP needs a Section A and the questions answered for them.
Okay, thank you.
Mhm.
The next question that we have is regarding individuals. If we're listing our facility administrators as having 100% operational control, and the facility supervisors, department heads responsible for operation units do not have individual decision-making authority, are we still required to report these operational unit supervisors?
So in this instance, if your facility administrator has 100% of operational control, that's the level we're looking for because I would expect the other areas are making those decisions, but that administrator is involved. So we're looking for who has that high level, that overall operational control. Now, if the other individuals are creating policies and procedures for SNF operations, they may qualify as an ADP. And what I would suggest is going through those sections and looking at those yes no questions to determine if they qualify. That is why that was structured that way.
Okay, the next question then, if there are 10 LLCs with indirect ownership interest, for an example, linked to a SNF in a corporation structure, how can all of these be completed online in Pecos with all of these pages in Section D? Will the pages need to be printed off and uploaded as a document?
Excellent question. They will not. So when you're filling out that information in Pecos, you'll complete it for each entity individually, answer the questions for each entity, and then there will be add additional or add another. I cannot remember the wording, I apologize. And then you will repeat the process. That way you don't have to print out paper sections. The idea is everything is in Pecos. You just fill out the section for one individual, hit add, it'll give you a clean section, and you just keep going.
Okay, thank you. Our next question is, this particular provider or person has 35 different SNFs enrolled with WPS. 34 of them got letters for round one. Is there a way that we can get these split into thirds? We also have SNFs with two other MACs. They also got letters in round one. So in total, we have 43 or 49 due all at the same time. Is there anything they can do about that?
Unfortunately, I can't answer that question, but I do have a recommendation. I would reach out to the Provider Enrollment Contact Center, and they would be able to direct you as far as who to contact. Again, I can't guarantee that that is something that is possible, but we can get a referral into that provider enrollment area, and they can take a look at that. So with that, I apologize for the questions that we haven't gotten to yet. I will answer those in a follow-up document, but I want to be respectful of everybody's time today. And I just have a couple of things to wrap up. But again, the questions we didn't get to today, I will be sending out a follow-up document. It'll be early next week, getting that information to you. So before we wrap up, I do need to make everyone aware of something that is coming up. CMS is committed to protecting protecting the information of our beneficiaries from Medicare fraud. So as part of that ongoing effort, CMS has instructed MACs to remove eligibility information and discontinue that from being available on our interactive voice response system, our IVR systems. For WPS, that is going to occur on January 1st of 2025. I have included a few resources. That eligibility information is still going to be available on our secure portal, and we do have some upcoming education on that if that's not something that you're familiar with. So I do encourage you to take a look at those resources, but something to be aware of starting January 1st of 2025, that eligibility information will no longer be available on our IVR. So in a few minutes, once you leave the webinar, you are going to receive an email thanking you for attending today. And again, I thank you for sticking with me. I know I'm running just a little bit over. But I'm going to encourage you not to delete that without reading it. If you've attended today for continuing education credits, this is going to serve as your certificate achievement for your accreditation or certification body. You will see the date and the course contact hours in the bottom of that email, and that email can be submitted to those accreditation or certification bodies for those continuing education credits. If you don't get it, a couple things happened. If you joined by phone, I don't have a way to systematically send that to you, um, or it went to your junk or your spam filter. If either of those is the case, you're not out of luck. Send me an email to that WPSGHA education mailbox and just let me know you need your certificate and let me know the phone number that you joined from. Once I confirm your attendance, I can manually send you out a certificate so that you have that. I will be taking follow-up questions for the next 7 days. Again, that can be sent to that WPSGHA education mailbox. In the subject line, I just ask you to put the subject for today, which is CMS 855A, changes in skilled nursing facility attachment. That's just going to notify the person or the individuals monitoring that mailbox that, hey, this is a question for Leanne, and I'll go ahead and get that response out to you. If it is claims specific or if it's application in process specific, those do still need to go to customer service because they simply don't have access to the systems to answer those. So just bear that in mind. So as I said in the beginning, I am going to ask you to take a few minutes to complete a survey. Again, our ultimate goal is to make sure that you have the education that you need to make navigating the Medicare program and these changes easier for you. So if I would appreciate if you took a few minutes to take that, if you could tell us what you liked, what we could do better, and as I said in the beginning, any suggestions for future topics that you would like to see. Your feedback is super important to us, CMS, and it really does drive everything that we do here in provider outreach and education. So you do have a couple of options. There's a link in the chat. You're also going to get a redirect as you leave the session. That's not spam, it's not malicious. It's just letting you know that you're leaving the webinar software and you're going into our Qualtrics survey software. So that will end the presentation for today. On behalf of myself, Ellen, and everyone on the WPS Provider Outreach and Education team, I'd like to sincerely thank you for taking time to attend today. We understand everybody's super busy and sometimes it's hard to carve out this hour, so I do appreciate you all taking the time to join. Again, we look forward to those survey comments and any topics you'd like to see in the future. I thank you again for attending. I hope you are well and you may now disconnect.